Philip, thank you for joining me today.
No, thank you very much for having me.
Yeah, absolutely. Can you tell me a little bit about your work and what you do with the GABA A gene?
So I work in a very large group where we are basically trying to map out what is the genotype-phenotype correlations between for GABA variants. So what that means is a patient comes in with a variant. What does that variant functionally do, and what does that mean for their condition? And my role in that is that we are doing the functional analysis. So I work at the University of Sydney in Australia, far away from here. And what we do in our lab is that we actually test these genetic variants to see if they have any detriment to function and what it is. And variants in GABA A receptors are unique compared to, for instance, variants in some of the transporters like SLC6A1, which have the conference here where the SLC6A1 organization is also here. For SLC6A1, every variant causes loss of function to some degree, so the protein is not as active as the wild-type protein. For GABA A receptors, it's not necessarily like that. You can have variants that cause loss of function, but you can also have variants that cause gain of function, which means that the receptor is overactive. And both of these two phenomena cause havoc in children when they're early life, in their early life.
Yeah, so if I'm a newly diagnosed mother or father and I'm trying to learn this entire world, they're drinking from a water hose, to give an example, they're trying to figure it all out. What should they know about what you're researching and how it could impact their children?
Yeah, so I think actually the research we do, I like to believe that it's actually quite important, because one of the things we find is that I was talking about before, loss of function versus gain of function. What we find is that these two different phenomena on the same receptor actually causes very different clinical presentations. So the phenotype of your child, what you'd call the natural progression of your child will very much depend what the variant does. So I think I maybe forgot some of your question, because you had something I wanted to say to. Can you repeat it, then I will.
Yeah, absolutely. Just if I'm newly diagnosed.
Yeah, if you're newly diagnosed. So of course for the newly diagnosed, for parents, I mean, devastating. And then they want to learn as much as possible. And unfortunately many times the neurologists that parents work with don't always know about GABA A receptors and variants, because there's so many diseases they have to handle. So what I think is happening in these years, that's great news for parents of children with GABA A receptor variants, is that we are starting having these online portals. And what I would very much suggest, because our group is actually involved in building a GABA A receptor specific portal. And I would advise that these new parents actually look there. They will get a lot of information there. There will be general information. There will be specific information. And then, try to gain the information from there. Reach out to the research groups that are active in the field, and try to learn as much as you can. A GABA protein, a typical GABA A receptor subunit has between 450 and approximately 500 amino acids. And so there are a lot of different possibilities for variants in these genes. They are not all pathogenic. That's important to realize. There's a lot of variants that are not pathogenic, but there's also, unfortunately, a lot that are. And so sometimes you can be lucky that the variant that your child has been analyzed before, and then you can see, for instance, on our portal or in the literature, to see if it has been tested before. If it is not, then there are ways of predicting, and in fact the portal I was talking about before also will do prediction of the variant outcome.
Wow. Your research, what is the outcome that you're hoping for? Is there a pharmaceutical intervention? Is there what end result could come from the research that you're doing?
Yeah, so I mean, this is of course the dream for us to have drugs that can treat every possible condition you can have in GABA A receptors. I come from the drug discovery industry. I worked almost 20 years in drug discovery in industry in the research and development part of the company, and it is extraordinarily challenging with GABA A receptors because there are so many different subunits. So to make traditional drug discovery, it's not really possible to make a drug for every possible variant that's out there. That's simply not feasible because the cost of making a drug far goes beyond what can ever be as a company, what revenue can ever be achieved. So we have to group them. We have to find out to group patients into larger categories where you have enough in the category that it makes sense to try to make a drug that helps. And this is one part of the journey, is to know what can help you. But what is actually equally important is that with GABA A receptor variants, because there are these LOFs versus the GOFs, I mean loss of function versus gain of function, there's actually a lot of drugs that are being used in the clinic nowadays as anti-seizure medication that is counterindicated, that you should not use. So you could have, for instance, a patient with a gain of function variant presenting with a spasm, infantile spasm syndrome, and we know they should not be given this drug called Vigabatrin, and it's actually a drug that's very often used for spasms. So we have seen, and we have published on this, that actually causes severe adverse events. So from a drug perspective, it's very important to find out what works, but it's equally important to find out what you should not use. Because you can actually have a scenario where a child is being dosed with an anti-seizure medications for years, and in fact, they would have been better off without it.
Wow. Your work with Cure GABA A and the research that you're doing, how is that linked?
Oh, so Cure GABA A has done an incredible work in this field. I mean, I think it's amazing how far they have come in such a short time, and they truly are moving the field forward. As you can see, I'm just sitting here at the conference here, and very impressed with what they are doing with all these different elements of it. For us specifically, the research group I work with, which is together with Professor Møller in Denmark, and our team in Sydney, and we also have a team at University of Copenhagen and in Melbourne, so it's a quite large group. We are quite dependent on also getting contact to patients. For us to study what variants do on GABA A receptors, we need the variants. We also need the patient information. So when patient reaches out to us, it's actually really valuable because we can directly gain information from them and learn, and then that can enable us to study more variants and get a better idea of what these variants do to the GABA A receptor.
So is it safe to say that we can expect to see you at the 2026?
Possibly, yeah. It might depend because coming from Australia and also having a base in Denmark is sometimes complicated traveling-wise. This time I went first to Denmark and then from Australia to Denmark and then from Denmark to here. It's a lot of traveling. So sometimes we split the tasks and we are a large group. And some people cover this and other people cover that. So I would like to come next year. I don't know where it's going to be.
Yeah,
but,
I think it will be Denver, Colorado,
yeah,
around the same time. But we hope to see you there, and I appreciate your time, Philip.
Okay.
I really do. Thank you so much.
Thank you very much. Thank you.